Okay, now we got it recording, and then let me project.
You share first.
Okay, share the screen. Screen is,
No, that one.
let's do the presentation. Looks like the Zoom doesn't like us. Zoom doesn't like us. Share the screen. And let's see, this is the screen we are sharing.
No, you can avoid sharing.
Okay.
That's not the right.
So this is the one.
No.
So now we're going to this. Okay. Now you can see our screen, right, with the PowerPoint presentation.
Yes, I can see it.
Okay. So, and then let's see.
That one is this one, that one is this one. So
Let's see.
It's not the full screen one.
It's not the full screen. Okay, let's see. Let me switch the screen. And then we have Nancy too. Thank you, Nancy, for joining us. We're trying to solve some technical problems. And then sharing the screen. Okay. Looks like we might need some Zoom class to teach us about how to share the screen for the PowerPoint. Now I think finally we've sorted out.
Perfect.
You got it, right?
Yes.
Okay. Let's see. Okay. So welcome all of you. We are very excited and welcome to our first webinar from the Empower Arthritis and Rheumatology Center. And many of you are aware, we are rheumatologists here taking care of patients with a lot of autoimmune conditions, including some of the arthritis conditions. And as we talk about arthritis, the food is a very important part of how we treat our patient. That's why we thought this will be a good start to talk about how we manage autoimmune conditions, starting with good food. And when I think of food, I usually remember my childhood days when I was a kid and I used to come home from school. And then my mom used to prepare dinner and then lunch for me. And at that point, I did not have to think about which is a good food and which was a bad food or which was not a healthy food. Because if you remember back then, we didn't have access to all of this not so healthy food at that time. Now I compare my life now as a parent, and when my kid come home from school, I have to be cautious. I have to cautious what I'm feeding him, because as you know, we have so much easy access to not so healthy food, and then too much access to this unhealthy food. That's why we thought that we should also share our ideas on what is a good food for an autoimmune condition. If you have arthritis, if you have other autoimmune condition, how can we best serve our body with the good food? That's why we made the title of Food as Medicine, so that we just not prescribe medication, but also give you good advice on the dietary changes. That's what we'll be talking today. And many of you are already aware, I'm Dr. Ananda Subedi. I'm a practicing rheumatologist here at Empower Arthritis. And as a passion, I also run a YouTube channel called The Rheum Doc, where I usually share a lot of other health information which help our patients learn about those autoimmune disease. And I have my colleague, Dr. Gupta, here with me, whom we practice together, along with our other colleague here in the practice. So we'll both will be sharing our experience and knowledge about food and as medicine. Now, just a disclosure, even though we are doctors, we are not allowed to prescribe anything over the video. So that's why this is more of an educational content where we'll be sharing our advice. It's just a medical advice. This is not a medical treatment. So always consult with your doctors, with rheumatologists, if you are planning to change any treatment changes regarding your health. So always consult with your doctors before making any major change with your medications. So these are our three main learning objectives. So we'll talk about what is the role of food in some of those autoimmune rheumatic diseases. Some of the common example, rheumatoid arthritis, psoriatic arthritis, lupus, and many others. So we'll focus on those autoimmune rheumatic diseases. So we'll also learn a little more about what is an anti-inflammatory diet. What type of food constitute an anti-inflammatory diet? And the third important one we talk about is what are the food we need to avoid that could flare your autoimmune disease? So we'll talk about some of the dietary recommendation on what to avoid. So those are the three main objectives. And at any point, if you have any questions, note those down so that at the end, when we have question and answer session, we can talk about more about your specific questions or a specific situation. And then we'll also do this as a more of a question and answer session so it become more interesting and interactive. So we'll be setting some questions and we'll try to answer those questions. And my first question I'll ask Dr. Gupta. So now as our slide title says, food as medicine. So what does food as medicine mean for people with autoimmune rheumatic diseases? Can you make it a little more simple for our audience to understand?
So first thing, the disease we treat is autoimmune rheumatic diseases. They are usually occurs because of the immune dysregulation. So they are attacking the joints or organs. So nutritions are helpful to they can help people to reduce their inflammation, and also it can help regulate their immune system. So that's why the food is very, very important. So when we use like a diet such as anti-inflammatory diet that Dr. Subedhi is going to talk about, that can reduce the inflammation and also can help patients to have a less pain and improve their fatigue level, etc.
Okay, so basically what Dr. Gupta is telling us about is we use medication, but food is also part of the medicine. So it's not just the medication that will fix the problem, but we need to incorporate both good food to nourish your body along with the medication that we prescribe as rheumatologists. Okay, now let's see. Okay, now the next the topic that we're talking about is what are those specific diet recommended for autoimmune conditions?
So there are many diets, have been, discussed, and it's like always a question that's been asked in the clinic all the time, that what is the diet I should be eating for rheumatic conditions such as rheumatoid arthritis or psoriatic arthritis. So if you go back and look at the evidence, like people talk about like a vegan diet, people talk about the elimination diet, people talk about the Mediterranean diet, people do talk about nowadays a lot of people talk about the fasting. So there are a lot of diets they talk about. For this talk, we're gonna focus mainly on a Mediterranean style diet. The reason behind it, that's the diet has the most evidence in reducing the inflammation. Is rich in the fiber, healthy fats such as omega-3, and also has an antioxidant that can help with the immune modulation. And also this diet is, sometimes I tell my patients all the time that this is very important, that whenever we choose a diet, it's very important that we choose a diet that works with you and your family. Because if you're gonna choose something that's not gonna work with you or your family, then it's hard to stick with it. So this diet, Mediterranean diet, is much more sustainable for the long term, because if people do 30 days diet and they go back to the regular diet, then it might not help. And also it's flexible. So it means it can be done anywhere easily without much trouble. So that's why Mediterranean diet, has the most evidence in the autoimmune rheumatic disease so far. So we're going to focus our talk on the Mediterranean diet.
Excellent. So basically, some of those audience who just joined, so what we're talking today is we're trying to learn what are the good diet for patients who have autoimmune diseases. So we're talking about different lifestyle changes or dietary changes that could help supplement the medical treatment you are getting from your doctor. So we are talking about supplementing dietary intervention with medical treatment. And Dr. Gupta just mentioned about the importance of Mediterranean diet, which has the most evidence on how it could effectively help reduce inflammation along with your medical treatment. Now, the next question we always hear from our patients is...
So I think this is a very common question being asked. Which food are considered anti-inflammatory and why are they important?
So basically, I categorize them into three different categories. So many of the things that you just mentioned earlier regarding the Mediterranean diet. So if we look at the Mediterranean diet, we need to look at what it contains. So it basically contains a lot of fruits, and even within the fruits, there are colorful fruits like berries, blueberries, raspberries. So those colorful vegetables or fruits typically have a lot of natural anti-inflammatory, we call polyphenols. So polyphenols are basically a component in the food that are colorful and that are considered to be natural anti-inflammatory. So that's why the berries are very important as a natural anti-inflammatory. They also contain a lot of green vegetables, which have a lot of fiber. So fiber is typically helpful for your gut. And when we talk about gut, there's a concept of what we call a microbiome, which is basically all the collection of bacteria in our gut. And the fiber typically feed those good bacteria, causing good microbiome. So that's why the fatty fish, the berries, the olive oil, those leafy green vegetables are some of the most important component of an anti-inflammatory diet. And what they do is they also have this natural antioxidant. Basically, the antioxidant are protection against the chemicals that can harm your cells, that can also activate your immune system. So they usually help calm down the immune system. And you can use the example of some of the medication you use. So when you have pain, sometimes you go to the outpatient store and you take ibuprofen. So ibuprofen is a chemical anti-inflammatory molecule, but this plant, they have this natural anti-inflammatory component that typically help calm down your immune system. And I use the term cytokines in this slide. So cytokines are basically chemicals that our immune system produce to cause inflammation. Like, for example, in rheumatoid arthritis, there's a chemical you will hear called TNF, which is basically a molecule our body makes to cause inflammation. So when you take this anti-inflammatory food, it typically reduces those chemicals, the cytokines, so that your body does not attack your joints or your tissues. And that's how it can help minimize inflammation. And the most important other thing is you have to have a balanced diet, right? It's not just one type of food you use. You need to balance those with healthy fruits, nuts, olive oil, green leafy vegetables, and also some animal product, like, for example, fatty fish. So if we combine those together, that is what we call an anti-inflammatory food. And within the anti-inflammatory food, we also want to avoid some of those inflammatory food, which we'll talk a little more. But these are the anti-inflammatory chemicals are typically found in this type of food, such as fatty fish, berries, which are typically colorful fruits, olive oil, and leafy green vegetables. And the next one we'll talk about is a little more on what are those food that we need to avoid. And these are basically three categories of condition or food that are typically considered to be inflammatory. These are typically this highly processed food, excess sugar, and refined carbohydrate. And why they are important to avoid is they could trigger autoimmune conditions. Based on what we know so far, these are three categories of condition: the processed food, excess sugar, and refined carbohydrate typically cause sugar spikes, and sugar spikes are typically considered to be inflammatory response. So that's why minimizing those highly processed foods, sugars, and the refined carbohydrate minimize those sugar spikes and can help reduce inflammation. And some of the highly saturated and trans fat are also not very good for your arthritis and autoimmune condition. They typically worsen your pain and the fatigue. And these are some of the examples which are very easily accessible food, like cakes, cookies, pies, and few other things that is listed here. Those are those inflammatory food that is better to avoid. Now, elimination is sometimes hard to do, so you always need to understand what your body can tolerate. So that's why I add that concept of journaling, which basically is you write down what you eat today and then understand your symptoms, how you feel the next day, in the next few days. If you feel that certain food cause those pain, make you more fatigued, and then you have these symptoms, it's better to avoid those type of medication, or sorry, those type of food. So that's why the food journaling is one of the better way of understanding what is good for you, what is not good for you. And on top, you can also get some suggestion from your dietitian who can guide you what are the good food to add and what are the good, not so good food to avoid. And your rheumatologist like us can also help you guide what are those food that can cause those trigger or flare of your arthritis.
So,
Okay. Now, the next one is for Dr. Gupta. We talk about a lot about supplements. So what are the supplements our patients should try?
So there are a lot of supplements we've been asked in the clinic all the time. Like people talk about the omega-3, vitamin D. People ask about the turmeric. So those are a lot of supplements they talk about. But what, most of the evidence suggests that the food first. So we try to take those supplements, like we try to take those, like omega-3 or vitamin D from the food itself rather than taking as a supplement. So supplement can be complementary to healthy food if if your doctor feels like you need those supplements because maybe you're not taking enough of those. But it's best to take omega-3 or vitamin D to the food. For omega-3, as Dr. Subedi mentioned earlier, like good sources are like nuts. Usually we talk about like a walnut, we talk about the pine nuts, talk about the almonds, pistachio. And for the omega-3, also the cold water fish, something like sardines, salmon. So those are the food that has a lot of omega-3. And itself, the cold water fish also has a lot of vitamin D as well. But also people can consider if they're vegetarian or they don't eat fish, or they hate fish, so they can consider something along like a milk. People sometimes have intolerance to milk, so people take substitute for milk, and they usually have vitamin D, tofu, and other things such as yogurt. They also have vitamin D. So those are the supplements are usually recommended taking it through the food. But if you think that you're not getting enough, talk to your doctor. They can guide you further. And then other supplement, people ask us about the turmeric. So turmeric, like I've been raised in India, so we use it in our food in a curry all the time. Turmeric, so for me it's okay, but for some other culture is not something norm. So it can be difficult for people to get turmeric. But turmeric, when they take it to the tablet, it does have some inflammatory properties such as ibuprofen that can put people at the risk of bleeding, like a stomach bleeding and other bleeding, etc. So make sure you talk to your doctor before you decide to use turmeric or anything like that, because it's very important that you don't have a side effect from those drugs. So next slide, Dr. Subedi is going to talk about what practical steps can someone take to start eating for less pain and having more energy.
Absolutely. Now, this becomes important because changing your diet is hard, right? It takes a lot of effort. One is you need to go buy in the grocery to find some healthy food. You bring those food to home, you process, you prepare. So it takes a lot of effort. Unless we have a good habit, we have a good system in place, sometimes it's hard to use what we learned today into practical steps. So these are some of the ideas that we are sharing with you all so that you can at least start with some tiny steps. And the first thing I add is add some colorful foods. As we discussed earlier, these colorful fruits have a lot of anti-inflammatory chemicals, which are natural. So at least including one plant-based colorful fruits in your diet, at least one a day, that might be a good start. And if you add, you can slowly incorporate more anti-inflammatory food in a regular basis. And the other one is sometimes we have so much easy access to unhealthy snacks, like for example, chips, chocolate. Those things are much more easily available. That's why we tend to go to those. But if you plan smartly, if you prepare your own snack, like for example, keeping some nuts in your bag or in your office, which is more easily accessible, then you may not reach out to those cookies. You may not reach out to those chips, and you have easy access to this healthy food. Yogurt is another easy snack to carry with you when you are in the workplace or at your home too. And also easy to use fruits, like dried fruit is also a good way of snacking without adding extra carb and can also be anti-inflammatory. And one key thing is whenever you think about building any new habits, always start small. Maybe add one thing at a time. And if you do one thing at a time, it's more doable. You can do those in a consistent basis. And when you become consistent, that becomes a habit. You don't have to think about those healthy habits. So start small, but make it a consistent changes, and also have some goals. Always set some goals. For example, if you are setting a goal, I'll eat one anti-inflammatory food every day for the next 30 days. And then just understand that if you set those goals, your body tend to do those things. Your mind will tend to do those things. So that's why setting the goals, which are tiny but consistent, always get you to the right results. So always think of creating those goals in a consistent manner. And then the next one is Dr. Gupta will talk about a little more lifestyle, hydration, alcohol, and what are the role of smoking and on those autoimmune diseases.
So the hydration, importance of hydration is the first thing it's going to help, is because in our brain, when I was studying anatomy and my physiology, what I learned is, the hunger receptor and then the thirst receptor are located very close to each other. So sometimes, I feel that I'm hungry, but what I typically do, I drink a glass of water before I start eating. So what it helps me that, okay, then I realize that, oh, I'm not hungry. Actually, I was thirsty. So having that's the importance of hydration, because if you hydrate enough, for most of the people, like for the women, usually need around 60 to 80 ounces of plain water. You can have a water with some flavor, like, put some lemon in it or some strawberry in it. Those are okay. But try to avoid drinks such as soda, because those are not hydrating. Those are actually gonna dehydrate more, like coffee, tea. Like a lot of people ask me, oh, I drink a lot of tea or coffee. And I said, that's not hydration. That's actually a dehydration, because your body actually pee a lot when you drink those content, because that has a caffeine or tannin in the tea. So important of hydration. For the male, usually hydration is around 80 to 100 ounces. Of course, sometimes the doctors tells patients to drink less if they have other conditions. So make sure you talk to your doctor before start hydrating yourself, how much water you need. And the second thing, we talk about the alcohol. That's usually a very touchy subject when I try to talk to my patients about it, that how much alcohol I should be drinking with the autoimmune conditions. So, the typical standard, what we see is like, one drink a day, that's what I typically see. That's what's considered like a moderate alcohol intake, like less than 7 drinks a week, So moderation is a key, but people are on certain medication with the autoimmune rheumatic diseases, such as like methotrexate or other drugs that also has to pass through the liver and all those things. So what we recommend at this time, recommendations are from the society and all, is usually a less alcohol. And then other thing is we talk about smoking. So smoking, like, when we study all this condition, most like rheumatoid arthritis, lupus, what we understood is smoking kind of lit up your autoimmune, like a immune system. So people, when they're smoking, they're lightening up their immune system, and that can actually lead to the worst, like an inflammatory response. And also, sometimes some of the medications people are taking for their autoimmune rheumatic diseases, they become less effective, people who are smoking. So it's very important, like no alcohol or limited alcohol and no smoking. Another thing we talk about is a healthy lifestyle habits, like, as you talk about avoid tobacco, limiting alcohol, and regular exercise. What the regular exercise does for the people, especially that we deal with autoimmune rheumatic disease, because they have a lot of joint inflammation and all. So what start happening is their muscles start getting weaker. And once their muscle getting started weaker, then it's hard for the body to fight the inflammation, because the muscles are not strong enough. They can't pull the inflammation from the joint back to the blood, and the drug doesn't work. So it's very important for the people to do the exercise on a daily basis. And also the exercise can help with their fatigue as well.
Okay, excellent. Now, let me quickly summarize some of the key points that we talked today. And then I start with a concept which we call mindful and balanced eating. Having a well-balanced diet is always important, including plant-based products, some of the fish, some of the supplements. So combining all of those things together is the best way to manage your autoimmune disease with diet. And mindful is also being a little mindful of what you are eating. What's the calorie content? Does it have good content or not? Does it have any other unnecessary chemicals? Being mindful of what you are putting into your mouth is so important. And other one is making some changes that are sustainable. As Dr. Gupta mentioned, sometimes making those lifestyle changes is hard. So that's why we need to think of what is sustainable, what is doable for long term, rather than just thinking about a month or a week, right? If you can make changes for a week, but it's hard to sustain if it is not a reasonable goal that you are setting. And having those small, sustainable dietary changes and lifestyle changes could help you support and continue long-term health. So that's why look at those small baby steps, but a consistent baby steps. And then we also talk about some of the important anti-inflammatory food that includes some of the colorful vegetables. Think of the Mediterranean diet as one of the key example of a good anti-inflammatory diet that could help reduce your pain, boost your energy, because a lot of fatigue is a common in those autoimmune condition. And overall, our goal is to enhance our quality of life by combining this lifestyle changes with food along with all of the medication we do use to help balance your immune system. So that's why it's a holistic way of managing your overall health. And that's our last slide, and we'll open the floor for any questions. And let me stop sharing our screen so that you guys can see our face. And I'll also stop the recording too. Okay, let's see.